When someone hits their head frequently, even if it is mild or strong, it can result in a variety of medical issues. The head is one of the most complex and important parts of the body, as it houses the brain, which controls nearly every bodily function. The following is a detailed explanation of what happens when someone hits their head frequently, including the potential medical consequences. First, it is important to understand that the brain is protected by the skull, which acts as a barrier against trauma. However, when the head is hit with enough force, the brain can move around inside the skull, causing damage. This damage can range from mild to severe, depending on the force of the impact. Mild head injuries, such as concussions, can cause symptoms such as headaches, dizziness, nausea, and confusion. These symptoms typically resolve on their own within a few days to a week. However, repeated mild head injuries can cause cumulative damage to the brain, leading to long-term cognitive impairment, memory loss, and other neurological problems. This is especially true if the person continues to engage in activities that could cause further head injuries, such as contact sports or other high-impact activities. Moderate to severe head injuries can have much more serious consequences. In these cases, the force of the impact can cause bleeding or swelling in the brain, which can lead to a range of neurological symptoms. These symptoms can include confusion, seizures, loss of consciousness, weakness or numbness in the limbs, and difficulty speaking or understanding speech. Severe head injuries can also cause skull fractures or other damage to the head and neck, which can further complicate the medical situation. One of the most serious consequences of repeated head injuries is chronic traumatic encephalopathy, CTE. CTE is a degenerative brain disease that has been linked to repetitive head trauma, such as that sustained by professional football players, boxers, and other athletes. The exact mechanism by which CTE develops is not yet fully understood, but it is believed to be caused by the accumulation of a protein called tau in the brain. Over time, this protein can cause the brain to shrink and deteriorate, leading to a range of cognitive and neurological symptoms. These can include memory loss, confusion, depression, and difficulty with movement and balance. In addition to the direct medical consequences of head injuries, there are also other potential complications to consider. For example, if someone hits their head and loses consciousness, they may also be at risk for secondary injuries, such as choking, aspiration, or hypoxia. They may also be at risk for complications related to the treatment of their head injury, such as infection, bleeding, or further brain damage. In summary, hitting your head frequently, whether it is mild or strong, can have serious medical consequences. Mild head injuries can lead to cognitive impairment and other neurological problems over time, while moderate to severe head injuries can cause bleeding, swelling, or other serious complications. In addition, repeated head injuries can increase the risk of developing chronic traumatic encephalopathy, a degenerative brain disease that can have long-term consequences. Therefore, it is important to take head injuries seriously and seek medical attention if you experience any symptoms or complications. Additionally, it is important to take steps to prevent head injuries, such as wearing helmets during high-impact activities and avoiding contact sports if you have a history of head injuries. Subscribing and liking the video are a great help. Thanks for watching.